Mrs. Jones, this is Brittany. She's going to be your nurse till 7 this evening.
Good morning.
She's a great nurse. She'll take good care of you today.
Good. Is she as good as you?
Yes. To protect your health information, we're going to ask your sister to step out for just a minute while we do report.
No, I don't want to leave. I don't like to leave her alone.
Okay.
I would really like her to stay in it.
Okay, that's
okay.
fine.
Okay.
We have to make sure it's okay with you before we start report.
Oh,
Okay,
it's
good.
okay.
All right. This is Mrs. Jones. She came in yesterday from home with pneumonia from Dr. Hayes. Admitted with Dr. Hayes. She does have crackles in her lungs. She has a medical history with thyroidectomy and takes Synthroid for that. She also has had arthritis with the right knee replacement about a year ago.
Yeah, that's still really, it just bothers me.
Does she have anything for pain?
She takes ibuprofen for that, and she has complained of some pain throughout the night. I gave her some ibuprofen, 600 milligrams, about 5:30 for that. And she's now rating it a 3. And you said your acceptable pain level was about a 4, correct?
Yeah, that's fine.
Okay. She doesn't have anything else ordered for pain, so you may have to call Dr. Hayes and get something else if she continues to complain of pain.
Okay, I can do that.
And then she has the D5 happiness at 75. And then she gets cefazolin every 8 hours.
Okay.
And cefazolin is that antibiotic I was telling you about that Dr. Hayes ordered to help clear up that pneumonia. She's been on oxygen most of the night at 2 liters, but she does get short of breath when she's up, and she has dropped down a couple times to about 87%. So I have bumped her up to 3 liters.
Yeah, I took that off. It was really hurting my nose.
Okay, well, as long as you
Peggy, we've talked about that. If you don't keep that oxygen on, we're never going to get you out of here.
She has the pulse ox on, so if it starts to alarm, we'll have to put it back on you.
Okay, is there anything we can do to make my nose less sore?
We can try humidification. It'll add some water in that and keep the air so that it's not so dry in your nose.
Oh, that would be good.
Okay. Her white count is also elevated. It's about 14.2.
Is that bad? That sounds really high. Is that bad?
It's a little high, yes.
It's
So
not horrible, but it is a little elevated. But that's why we're on the antibiotics.
So the antibiotics will fix that.
Mhm.
Okay. Sorry. Keep going.
And she has had a temperature also. The highest was 101.2 about 11:30 last night. And she had some ibuprofen around that time, and it has come down to 99.1 was her last temperature.
Isn't that a little bit high?
The 99.1?
Yeah.
It's still a little high, but it's coming down.
Okay.
And Dr. Hayes has ordered a chest x-ray for her today to be done portable. They have not done that yet.
When do they do those?
They can do it any time. They usually call before they come up. I
Okay.
haven't heard from them yet, but they should do it pretty soon, I would think.
Okay.
And she also has a yeast rash under her abdomen and skin folds, and we're doing nystatin powder for that. And I told her because of the IV and the oxygen, and that she does get short of breath when she's up, to call before getting up. She has a high risk of falling.
I feel like I'm such a pain every time I call.
Stop.
You're
Peggy,
not a
stop.
pain at all.
With that bad knee of hers and all the tubes and everything, can we get her like a walker or something? Because I don't want her falling and staying here
Certainly.
forever. Because she's my roommate at home and I'm lonely without her. So we need to get back to home.
Sure, absolutely. We can get a walker for her.
See, Peggy, it'll be fine.
You don't need a walker.
You do need a walker.
And Dr. Hayes, he's already made rounds this morning, and he said before you can go home, he wants to see you that you don't have a temperature for 24 hours. He wants to see that the chest x-ray is improving, and then he wants your white count to be back to normal. So that's the things we're going to be looking for before we can send you home, okay?
Okay.
All right, and we have set goals today for you to use your incentive spirometer 5 times while you're awake, and she'd like to go for a walk today also.
We can do that.
So did I forget anything?
No, I think you've covered everything.
All right.
Let's look at her MAR. It looks like she's at medium risk for VTE, and I don't have there's no orders or anything for this, so I can call Dr. Hayes in a little bit to ask him if he wants to implement anything.
Okay.
What's that all about?
That's because you're in the hospital and you're not having having as much activity as you would at home, you're at higher risk to have a blood clot. So we kind of just do it just in case to try to prevent blood clots. He might order some medicine for you or some stockings to go on your legs to help circulation.
Oh, okay.
Let's take a quick look at your skin here on your abdomen that she was telling me about. It does look a little excoriated. Is it
Yeah.
hurting?
Yeah, it really itches.
Okay. We can get some nice satin cream for that.
Okay.
Okay.
All right. I'm gonna go ahead and write Brittany's name up here for you.
Okay.
And what diet is she on, Lakin?
She's on a cardiac diet.
Okay.
Thank you.
Is there anything else we can get you right now?
No, I don't think so. I think I'm doing okay.
All right. Well, Mrs. Jones, it was a pleasure taking care of you, and I hope you get to go home soon.
Thank you, Lincoln.
Thank you. I'll be back in just a little bit, okay?
Okay.